everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about measles. So measles is a viral infection and this is also known as rubeola. So here you don't get confused with rubella because rubella is a different kind of disease condition, and this is measles, which is called as rubeola. So this is an acute viral infection where you can see maculopapular rash, and these rashes comes over the neck and face, trunk, arms and legs, and which is also accompanied by high grade fever. So this is also a condition which is vaccine preventable. So we have got vaccine for this disease, and before, when there was no vaccine at that time, the peak incidence was among children who were 5 to 10 years of age, and then we've got vaccine. So now if we see the incidence, it's quite rare in this age group of children. And if we see certain areas where the vaccine rate is quite low, in those areas we can see that this is a leading cause of child mortality. So you can understand how debilitating it is, and this condition becomes really severe if it is not treated properly. And you have to remember that this is highly contagious disease. So measles is an acute viral infection which is highly contagious. So we are saying it's a viral infection, right? And this condition is named as measles. So what is the virus? So which virus causes this disease? So the name of the virus is also measles. Yes, so measles virus causes this disease, and this virus is actually an RNA virus which is from family Paramyxoviridae, and the genus of this virus is morbillivirus. So I've got to know that this is a viral infection which is caused by measles virus, and this is highly contagious, and this is a leading cause of death in children, right? Now, how the transmission occur, right? So let us move on to the transmission. Now, this is an airborne disease. Now, when we are saying airborne disease, that means you can understand that this virus transmits through air, right? So if there is an infected person who is carrying this measles virus, if that person cough or sneezes, then what happens? This virus comes out and it travels into the air, right? So when and through air it can also transmit to other person. So as I mentioned earlier that this is highly contagious, right? And that means, this virus can actually, be alive for a long period of time in the air. So that's the reason, if there is an infected person and around him, if there are, almost 90% people would get affected or would acquire this infection. Well, so we understood that this virus transmits through air, through droplets nuclei, right? Now, let us move on to the pathophysiology to understand how does it infects a person, right? So, again, if there is an infected person, right, who is carrying this measles virus, if that person coughs or sneezes, the virus comes out from his lung and it travels into the air. Now, when the virus is in the air, definitely the other healthy people who are around that infected person, they would inhale that infected air, right? So through this air, the virus would enter the enter into the healthy person's body, right? And it would enter the respiratory tract. So once it enters the respiratory tract and it would, target the mucosa, it would start to infect the epithelial cells, and which are present in the trachea and bronchi. So now the virus is in the respiratory tract, right? It has started infecting the epithelial cells which are there in the trachea or bronchi. Now, this measles virus, if you see the structure, we can see that this virus particularly uses a protein which is there on its surface, and this protein is called as hemagglutinin, right? So this, with the help of this hemagglutinin, this virus binds to a target receptor on their host cell. So this is how they bind with their target cell. Now, once they bind with that target cell, they would be able to fuse with the cell, right? And then they can get inside the cell. So now the virus is actually inside the cell, right? Now here inside the cell, the virus undergoes certain changes, right? There would be certain structural changes. Now in the earlier and previously we mentioned that this virus is an RNA virus, right? And this is basically a single stranded RNA virus, right? So here inside the cell, when the virus would undergo structural changes, this becomes mRNA, right? So before it was a single stranded RNA virus. Now here inside the cell, it would become mRNA through, after undergoing the structural changes. Now, once the structural changes occurs, after that, the virus would come out of the cell as a newly made virus, right? Now, this virus would have a lipid envelope. So, before it wasn't there, right? Before we know that it was just a single-stranded RNA virus. And now, after the structural changes, it has become mRNA, and then after this, it has got a lipid envelope also. So when the virus is out of the cell, this virus has a lipid envelope. So now this newly made virus is actually outside the cell, right? So what would happen next? Now next we have got our dendritic cells and our macrophages. Alveolar macrophages are there, right? So these would come and these would pick up this, this measles virus, and this alveolar macrophages or the dendritic cells, they would carry it from the local tissue of the lungs to the regional lymph nodes. So before it was there, this virus was there in the in the local tissues of the lungs, right? And now this would be carried by these alveolar macrophages and the dendritic cells, and they would carry this measles virus to the regional lymph nodes. So once it reaches the lymph nodes, then definitely, over time, what would happen? This infection would start to spread to the blood also. So there would be hematogenous spread. And then when there is hematogenous spread, eventually what would happen? This infection would also start to spread to other organs, so other than lungs. So initially what we are seeing that, the measles virus is actually targeting the lungs, right? It is entering through the respiratory tract, and then it is infecting the epithelial cells, and then with the help of its own protein, that is hemagglutinin, it is going inside the cell and then is undergoing some structural changes, right? So after the structural changes, this virus comes out as a newly made virus which has a lipid envelope, right? So this virus is now outside the cells, where this virus would be picked up by alveolar macrophages and dendritic cells. So this dendritic cells and this alveolar macrophages would carry this measles virus to the lymph nodes. Now once it reaches the lymph nodes, what would happen? It would start, over time, the infection would start to spread to blood also. So there would be hematogenous spread. Now when there is hematogenous spread, definitely the infection would also start to spread to the other organs. Well, this is how the whole infection process takes place. Now, once the virus enters the body, and after that, it has to go through all this process, and then the person will experience the signs and symptoms, right? So, to get the signs and symptoms, it takes about 10 to 14 days. So, the incubation period of this virus is actually 10 to 14 days. Well, so once the signs and symptoms starts, there are different stages. So here, let us next discuss about the stages of measles, right? So the first stage is called as prodromal period. Now this phase starts once the symptoms start, right? And after this incubation period, that is 10 to 14 days, after this time period, we can see that the person would start having these signs and symptoms, right? There would be appearance of the symptoms, and once the symptoms starts, from that day to till 3 days, this period lasts. So in this time period, that is prodromal period, here we said that the person would start to get the symptoms, right? So you can see the child will have high fever, there will be conjunctivitis, there will be stuffy nose, right? These are very common at the initial, we are saying that this period would last for 3 days, right? So among these 3 days, in the initial 1 or 2 days, you can see that these symptoms would be very evident, that there would be high fever, conjunctivitis and stuffy nose. Now after 1 or 2 days, there would be beginning of enanthem. Now what is enanthem? There would be rashes on the mucous membrane, which is a very unique feature of measles. So in this rashes, you can see that there would be grayish white dots, and this will be usually very small, and that it will have a slight reddish areola, right? This is called as Koplik spots. So this Koplik spots would be found in mucous membrane, and they would appear and disappear rapidly, and you can see that usually within 12 to 18 hours they would appear and disappear, and as they would fade, and you can see that a red spotty discoloration would be there, would be present on the mucosa. So this happens in the in the prodromal phase or prodromal period, and that we can see this Koplik spots. The next phase or the next period is exanthem period. So in exanthem period, you can see red blotchy maculopapular rash, and there would be there would be a particular type of progression in which this rashes would progress. So it's basically from head to the extremities. So you would see that the person or the child would develop this rashes over the neck, face, and then slightly it would come to shoulder and then chest and in the extremities, right? So that's how it develops from the head to the extremities, and this phase lasts for about 4 days. So after this exanthem phase, there would be recovery phase. So this recovery phase lasts for about 10 to 14 days, and here you can see that the child will have a persistent cough. Well, now I told you that this is a highly contagious disease, and this is an airborne infection, right? So if there is an infected person and that person coughs or sneezes, the virus would come out, and then it can travel into the air and it can infect other people also, right, who are around him. So here, when the person will be more infectious. So as a nurse, it's very important to know that, when the person will be more infectious, because this condition would last for about 15 days. Like each period, the incubation period itself is 10 to 14 days, and then we've got prodromal period, exanthem, and then the recovery phase. Right? So in the recovery phase, the person is actually not that infectious, but still they can transmit the infection, right? So the people who are infected, they are more infectious from the final day of the incubation period to the exanthem phase. Right? So we said that the incubation period is almost about 10 to 14 days. So at the last, when the incubation period is about to get over, from that time to till the exanthem phase, the person would be more infectious. So that time we have to be more cautious, because the infection can spread very rapidly. Now here, when we talked about the infection and what are the symptoms that we would see in each phases, you have to remember one more thing, that people who are immunocompromised, they might not develop any sort of symptoms. Now, here you can see that they won't have any enanthem or, the exanthem phases. So there won't be any rashes over their body, or they won't even develop this Koplik spots, right? Because they are already immunocompromised. So for example, a person with HIV, right? So in case if a child is HIV positive, if we have an infant who has got HIV from from the mother, so in that case you can see that even if the child has got measles, you cannot see any sort of signs and symptoms. So there won't be these symptoms whichever we discussed now. So here, the risk of complication is more. So they would be at more risk for pneumonia or encephalitis. Now we know that this virus, measles virus, affects the lungs, right? So if it's not treated properly, if we are if there is no signs and symptoms, most of the time the disease might goes unnoticed, right? So in that case, there might be pneumonia, there might be encephalitis, and because of that we can see that people who are immunocompromised, and if they get measles, they have the higher mortality rate. Well, next, moving on to the diagnosis of measles. So how we would confirm the diagnosis? Now, this diagnosis is usually done through this, through the signs and symptoms, and laboratory investigation is rarely needed. So we can see the scopic spots and the rashes, which is which would be from the head to which would appear from head to extremities, right, in that order. So through that only we can confirm the diagnosis. And if we need laboratory investigation, in that case we can do serology, where we can look for the measles antibodies in blood serum. Well, so next let us talk about the prevention of measles. Now we know that this is a highly contagious infection and this spreads very rapidly, right? So we have to take some measures to prevent this. So if we know that we have an infected person, if the child is in the hospital or even if the child is in the home, we have to take certain precautions, right, to stop the spread of the infection. So the first thing would be isolation precautions, which we have to take. So it's very important to isolate the child or isolate the person who is infected with measles, because if they're not isolated, the infection would spread very rapidly, right? And especially if the child is in hospital, in that case you've got other child also, right? So there you have to make sure that the other children they don't get get the infection, right? So there you have to maintain this isolation, especially from the 7th day after the exposure until 5 days after the rash has appeared, right? So we know that at the final day of the incubation period, right, so we know that it's 10 to 14 days. So definitely from the 7th day we would take this precaution, and till until the child has got the rashes. After that, until 5 days after the rash has appeared, we would maintain this isolation very properly. So this was when somebody is there who is already infected, and after that what are the preventive measures that we can take, right? Now the next thing is, I have already told you that this is a vaccine preventable disease, right? So that means we have got vaccine for this disease, and the vaccine that we use for measles is actually a live attenuated vaccine. Now this vaccine is given to the children at 9 months. This is the first dose, and then again it is given at 16 to 24 months, right? So that is the second dose. And this vaccine, the measles vaccine, is given with actually other two vaccines, that is mumps and rubella. So we call it as MMR, and this vaccine is given subcutaneously and the dosage is 0.5 ml. And the child can also get this immunity from the mother. So if the mother is having anti-measles antibody, that the fetus can receive from the mother. So this immunity is actually, it can transfer across the placenta. So this lasts about 9 months. So this was about that before the occurrence. So what are the, how we are preventing it, right? The vaccines that we give. Next is, let us talk about the treatment. So if we already have someone, who is infected with measles, in that case, the preventive measures we would take to stop the spread of infection, but to treat, to manage the condition, what are the treatment measures that we will take? So here we don't have any specific antiviral treatment. So if there is, if the child has already got measles, then in that case, so we don't have any specific treatment for measles, but all we can do would be supportive treatment. So we can give medications to treat the super infections which are present. Also, the child will have pain because of these rashes. So we can give pain relief. We can also give antipyretics because the child will also have high grade fever. So for that, we can give antipyretics. Well, next, let us move on to the nursing management. So in nursing management, first we would talk about nursing assessment, right? So nursing assessment, the first thing is that we would assess the child and we would look for, symptoms, right? So if there is any sort of symptoms which is indicating that the child might have, measles, right? So we have already learned about the signs and symptoms. So we know what are the signs and symptoms that would occur if somebody is having measles. So we have to basically look for that. We also have to assess the parents' knowledge about the disease, the family members' knowledge about the disease, and along with these things, we also have to assess their hygienic practice, right? The hygienic practice of the mother as well as the family members, because that is very important to stop the spread of infection. So next, let us move on to the nursing diagnosis. Now, nursing diagnosis, again, we have already discussed that the child will have pain, right? So definitely there would be acute pain related to skin lesions, and there will be impaired social interaction. If we have a child who is, preschooler or school going children, in that case, definitely there would be impaired social interaction related to isolation from friends. Also, there will be risk for impaired skin integrity related to skin lesions. And there will be high risk of infection related to the host and infectious agents. So these are the nursing diagnoses that would be there if somebody is infected with measles. Well, next, let us move on to the nursing intervention. So in nursing intervention, again, first thing would be, our focus would be to stop the spread of the infection. So for that, we would isolate the child, right? So isolation is very important here. So you would, as a nurse, it's your responsibility to make the parents understand that, why it is important to isolate the child. And also, if the child is a school going children, then again, you have to make sure that you have to take the responsibility to make the child understand that they remain isolated for this period of time. Next, you have to make sure that the child is properly hydrated. So for that, you have to encourage the child to, encourage the child for fluid intake. And also you have to make the parents understand that they encourage the child for increased fluid intake. Next, we also have to control the temperature. So if there is fever, then definitely we have to give antipyretics, but make sure that you don't give aspirin because that can cause Ray's syndrome. So to avoid that, we have to make the parents understand that they should not give aspirin to the child. Next, we can trim the fingernails of the child because this would cause itching. The rashes would cause itching. There would be pruritus, extreme pruritus. So definitely the child can, scratch, right? And if they scratch, then again there would be at more risk for infection, right? So for that, we have to trim the fingernails of the patient, of the child, and also we have to encourage the child to wear long pants and sleeves, to prevent scratching. Also, we have to avoid, heat or sunlight or any sort of hot bath, because that would again cause more itching or, more pruritus. So for that, we have to avoid, giving hot bath to the child or exposure to sunlight or heat. And to also we have to maintain the, moisture of the skin. Also, we have to provide eye care, because we learned that the initial days the child will develop conjunctivitis. So we have to treat that, and we have to encourage that the child should not, rub the eyes. So again, we know that it would affect the lungs, right? So there would be pneumonia. There might be diarrhea, that it can also spread to other organs, right? That we learned in the pathophysiology. So if it affects the intestine, then definitely there would be diarrhea. There might be encephalitis or otitis media. Bacterial superinfection and bronchopneumonia are more frequent. Well, so that's all about today's class. So let us conclude our today's topic here. So today we learned about measles, so which is caused by measles virus, and this condition is also known as rubeola. And rubeola is different from rubella, right? So this you have to remember, and you should not get confused with rubella. This is a different condition which is known as rubeola. So we learned about the, about the pathophysiology, how does this infect a person, and about the stages, right? What are the signs and symptoms that we can see, and how we can manage this disease, or, how we can prevent it, right? So I hope you've got a better insight about the topic. Thank you.